Introduction of ITP. ITP, also known as idiopathic thrombocytopenic purpura, is the most common hemorrhagic disorder, accounting for about one-third of all hemorrhagic disorders. In the adult population, the incidence of ITP is 5 to 10 per 100,000. The elderly over 60 years old are the highest incidence group, and the incidence of women of childbearing age is also higher than that of the men of the same age. ITP is the most common bleeding disorder in children, with an annual incidence of about 4 to 5 per 100,000. Children ITP. ITP in children is more relevant than viral infection because about 70% of children has a history of measles or respiratory infection in 2 weeks before the onset of the disease. What are the symptoms of ITP? The skin of people with ITP often has bruising or small purple spots due to the blood leaking from veins or capillaries. Spontaneous bleeding may occur in the nasal cavity or oral cavity. Patients with low platelet counts may experience brain bleeding. Treatment goals for children with ITP. The goal of treatment is not increasing platelets to the normal count, but to ensure that patients are not at risk of bleeding. What is the normal count of platelets? Well, for healthy kids, the platelet count should be 100 times 10 to the power of 9 per liter. Below this value should be taken seriously. Do I need a bone marrow aspiration? Well, first, we can look at the blood routine. If in addition to low platelets, there are other indicators such as red blood cells, white blood cells indicators are also abnormal. Second, when you have a low-grade fever of unknown region or have an unexplained joint pain. What's more, do it when it is necessary to rule out other malignant blood disease or when the attending doctor suggests it. Studies have shown that infection with Helicobacter pylori may lead to secondary ITP, so patients diagnosed with ITP are recommended to check whether they are infected with Helicobacter pylori with family members living together. What happens if ITP becomes persistent or chronic? If it persists for more than 6 months from the date of diagnosis, it is classified as chronic ITP. Since ITP is an acquired autoimmune disease, children are in the growth period, and children with chronic ITP also have a great chance to be cured or improved through self-adjustment or self-immunity enhancement. Is ITP contagious? Well, ITP is not contagious, so feel free to get in touch with those who have ITPs. Will ITP recur? In a small number of children with acute ITP who appear to have recovered, ITP symptoms may recur in the future. Recurrent ITP may indicate a shift to chronic ITP, which requires careful monitoring by parents in their daily lives. When should you check your blood routine? Well, first, during the period when platelets do not return to the normal. And second, in children with ITP, it is recommended to regularly review blood routine to know the counts of white blood cells, red blood cells, and platelets. What's more, if you have a cold, a fever, a cough, or when your body appears large purpura, blood spots, or when nosebleeds are frequent. Why do platelets rise after a fever or cold? Infection can cause thrombocytopenia, but children with ITP do not necessarily develop thrombocytopenia after every infection, depending on the type of infection and whether platelet-related antibodies are produced. Here are 2 ways that people who have ITP or people who nosebleed frequently can use to deal with their nosebleed. The first one is local pressing method, and the second one is nasal tamponade. What will happen when the children with ITP gets another disease? Well, when the children with ITP is infected with other disease, parents must be careful to explain to the doctor that the child is an ITP patient, because I was once have a fever and also an ITP. And at that time, there are some medicines that I cannot use because they will kill the platelets, which makes the ITP more serious. Can children with ITP participate in sports? Well, they can choose to participate in appropriate sports, which can enhance their physique and avoid infection. But try to avoid antagonistic sports such as football, baseball, and other sports that may result in injury. Can students with ITP go to school? Well, children with ITP can go to school normally if their platelets are stable above 40 times 10 to the power of 9 per liter. The class teacher, physical education teacher, and the school doctor should be informed of the children's condition in advance. And parents need to make it clear what to look out for when a children with IDP is in school. They should lower the requirements for academic performance of IDP children and take healthy and happy growth as a premise. Parents of children with IDP should be aware. First, they should trust the doctors, do a good job of communication with doctors. And second, they should learn and understand more about ITP medical knowledge. What's more, they should take careful care and show a positive face and strive to ensure the quality of life of their children with ITP. It is important for them to believe that most ITP children will go into spontaneous remission. Here are some medicines and supplies that an ITP patient should keep in their home to do serious treatment with their nose bleedings. And parents should focus on the mental health of ITP patients because they may experience different kind of pressure. First, self-stress. They may be stressful because they cannot do what they used to do. And the pressure from school. Well, they can see their classmates or other students are doing what their daily life, but they can just stay in home and dealing with nose bleeding. They will also face peer pressures. While every other students can have all their times to study or to play, they can just stay at home because of their own disease. And also the parental pressure and siblings. All these pressures will be on the IDP patient and strongly destroy their mental health. So parents should focus on it and take good care of them. About TCM treatment of ITP in children. When the platelet count for children with ITP can be stabilized about 30 times 10 to the power of 9 per liter, Chinese medicine treatment can be tried. The main function of TCM treatment is to regulate the immunity of ITP children, clear heat, and granted blood, cold, cord blood, and stop bleeding. In 1999, an ITP patient created an online forum, itppeople.com, as a space for other patients to share with each other and gain information and knowledge about immune thrombocytopenia. Soon, this grassroots discussion group would grow into the Platelet Disease Support Association. International Immune Thrombocytopenia Disease Week is observed from September 21st to September 27th every year. In 2010, the Platelet Disorder Support Association started a campaign to raise awareness of ITP and to show support for ITP sufferers. 2023 marks the 25th anniversary of Platelet Disease Support Society. To learn more, please visit www.pdsa.org or use the email in the PPT. In China, there's an ITP Home, a public welfare organization dedicated to serving patients with thrombocytopenia. Website is as follows: